Hey, future nurses! Welcome back to Nursing and NCLEX Simple Learning Hub, where we make nursing concepts super simple and fun. Today, we're learning about hepatitis A, the type of hepatitis that usually spreads through food and water. Let's dive in and make it easy to understand. What is hepatitis A? Hepatitis A is an acute viral infection of the liver caused by the hepatitis A virus, HAV. It leads to inflammation of the liver, which affects how the liver works. But the good news is that hepatitis A does not cause chronic disease, and most people recover completely. Whoa! Voy, cause, and mode of transmission. Hepatitis A spreads through the fecal-oral route, which means eating contaminated food, drinking contaminated water. Okay, poor hand hygiene. Okay, eating food prepared by an infected person who didn't wash their hands properly. That's why it's common in areas with poor sanitation and unsafe drinking water. World epidemiology, risk factors. Common in developing countries. Poor sanitation and hygiene. Uncooked or street food. Children and travelers to endemic areas are at higher risk. Pathophysiology, simple explanation. Let's make this easy. Here's what happens inside your body. 1. The hepatitis A virus enters the body through the mouth. 2. It travels to the intestine, then into the liver. 3. The virus infects liver cells, hepatocytes. 4. The immune system attacks these infected cells, causing inflammation. Damaged liver cells leak enzymes and bile, leading to jaundice, yellow skin, and eyes. The liver can usually heal itself. That's why hepatitis A is self-limiting and rarely causes long-term damage. Signs and symptoms. Symptoms usually appear 2 to 6 weeks after infection. Here's what you might see in patients. Fever and tiredness. Loss of appetite. Nausea and vomiting. Abdominal pain, especially right upper quadrant. Jaundice, yellow eyes and skin. Dark urine and pale stool. Itchy skin. Mild enlargement of liver. In some people, especially children, hepatitis A may have no symptoms at all. Diagnostic tests. To confirm hepatitis A, we use blood test, positive for HAV IgM antibody. Liver function test, LFT, increased ALT, increased AST, increased bilirubin. Physical exam. Enlarged liver, hepatomegaly. History, recent travel or exposure to contaminated food/water. Life, treatment, and nursing management. Since hepatitis A is a self-limiting disease, there's no specific antiviral medicine. Nursing care focuses on supportive treatment and preventing spread. ON, nursing assessment. Monitor temperature, pulse, and hydration status. Observe for jaundice, nausea, vomiting, fatigue. Record intake and output. Monitor lab results, LFTs. Rest and diet. Provide bed rest during acute phase. Offer high-calorie, high-carbohydrate, low-fat diet. Encourage small, frequent meals. Avoid fatty, fried foods. Increase oral fluids unless contraindicated. Ban 3 medications. Paracetamol should be avoided. Hepatotoxic. Warning. Give vitamin supplements. B complex C. Prescribe antiemetics for nausea if ordered. 1. Infection control. Encourage hand washing after toilet use and before eating. Use personal utensils for the patient. Disinfect contaminated linen and articles. Educate family about hygiene and avoiding food sharing. The patient education. Explain nature of the disease. It's self-limiting. Avoid alcohol completely. Maintain hydration and proper nutrition. Get Hepatitis A vaccine for prevention. Educate on safe food and water practices. Complications, rare. Acute liver failure, rare. Prolonged jaundice. Relapse, recurrence of symptoms. Prevention. Prevention is the best medicine. Here's what to remember. Boom. D. Maintain good hand hygiene. Drink safe, clean water. Eat cooked food only. Get Hepatitis A vaccination. Avoid eating raw shellfish or street food. So, nurses, that's the complete and simple overview of Hepatitis A, from causes and symptoms to management and prevention. It's all about hygiene, awareness, and supportive care. If this helped you understand better, don't forget to like, share, and subscribe to Simple Learning Hub for more easy nursing lessons. See you in the next video, future nurses!